Problems during pregnancy can be on either side, the male or female. For the woman, she's beginning to notice changes in her body. She's probably feeling that she's maybe losing her figure, not feeling as sexy as she did. And she's also aware of the new life that's developing inside her and wanting to protect that. And on the other side, the man may at the beginning not quite understand why his partner's changing so much and wanting to have sex as often as usually and feeling, what is wrong? Is she rejecting me? What's happening? And then he too can also have worries about maybe damaging a developing baby. I think particular problems at the stage of pregnancy can be for the woman the fear of letting herself go, of being orgasmic, because she's afraid that this might produce a miscarriage and she might lose the pregnancy. And again, for the man, the same kind of feelings. Well, if he's going to ejaculate, is it going to disturb the pregnancy? Patients who've had previous miscarriages or recurrent miscarriages are naturally far more anxious about their pregnancy than somebody who's spontaneously got pregnant and is doing quite well during the pregnancy. And these particular women will really try to avoid having intercourse, although as gynecologists, we tell them it's fine after 3 months. They often will still avoid intercourse throughout the whole of the pregnancy and put pressure on their partner because of this. During pregnancy, if the woman is less interested in having intercourse than she normally would be, from time to time it does occur that her partner might wander, there might be some infidelity that occurs, and obviously if the woman finds out about this and feels really let down, really cheated on, then terrific stress arises in this relationship. And so if there has been infidelity in a partnership, of course, I would see them both together, and probably during the first consultation, I'm dealing with an awful lot of anger, defense, guilt, all those kind of emotions come to the fore, and I might be sitting there almost keeping the peace between a warring couple. And once we've done all the anger, it's then okay to kind of separate them and listen to their individual needs. And perhaps then, you know, that the woman will no doubt be blaming the man and he's feeling guilty. But if you can also get her to see his point of view and what's happened for him during pregnancy, which is quite a long time really, then you can help them to develop a more stable and caring relationship. Recently, deliveries have become much more high-tech. And of course, women have choices about the birth process and can decide what they want to do before delivery. Very often things will not go wrong, but not go the way they want them to in labour, and they may end up with the sort of delivery they really hadn't wanted to have. For some women, not having a normal delivery will make them feel quite a failure, that they haven't managed to do what they wanted to do, and cause difficulties in bonding with the baby. For others, they just may find it really hard, and if they've had a cesarean section, for instance, and a baby's just been produced without perhaps a long labour, to suddenly relate to this new little person who's there can be a difficult process. But I don't think it's always to do with the technology of childbirth. It's to do with how a woman reacts to the baby and the circumstances and quite how much that child was wanted as well. And I would really encourage women to, even if their baby happens to be in a special care baby unit, to visit it as the baby as often as possible and to bond as early as possible. And again, same for the male partner.